So that is why the investment framework thinking is so important, that while governments, national governments are encouraged to invest more in their response, and in Asia Pacific, a lot of the countries are progressing reasonably well economically, so they should rightly invest more in their own national response. And in that sense, we have to look at where we can get good returns on investments. So that this is a very important, very innovative and important and timely approach to the response. 90% of countries in Asia Pacific have retained laws that probably come from the colonial times that actually are not progressing towards, how to say, they're not helping the response in terms of the existence of punitive laws and making it difficult for communities to actually access services or even address stigma discrimination. Yes, so in this region we have a lot of work to do. Oh, definitely. I mean, access to affordable medication should be there. And this is an issue that is actually very much taken up by APCASO, for example, and some other key population networks, because it will be very detrimental if affordable medicine or free medicine on treatment is not available to people who need it, or people who are eligible who need it. Yeah. I think policymakers need to understand the different needs of different communities within affected women and girls. It could be housewives, it could be intimate partners of drug users, or young adolescents, young women, sex workers, for example. So they all have very different needs and they have different concerns. And accessibility to services is an issue because health systems may not be geared towards understanding their needs. There may be stigma and discrimination at the clinic, for example. So people don't want to go and get services, get tested, whatever. So that is a concern. Well, we hope not, because like we say in the business, there is a lot of unfinished business. We have made a lot of progress in terms of falling infection rates, in terms of treatment access, the coverage of ART. Those things are really solid results especially from our region. But then, HIV is a lifelong illness, and it is a burden on a country's health system if you don't do something with prevention. Getting to zero would mean, involving the community very meaningfully from design, from implementation, from monitoring and results, the whole spectrum of a national program. And also getting to zero would mean government and donors investing in programs that actually are meaningful or impacting key populations, and getting the results from investment in what they call high impact programs, on programs that will bring results rather than programs that may not yield results without participation of key populations.